Hey everyone, welcome back to the Recovery RX channel. My name is Penelope and today I'm going to be interviewing one of our physical therapists, Dr. David. We're going to go behind the scenes on how he creates personalized exercise plans for his clients. So buckle up, and if you haven't already, please subscribe, give us a like, and let's get started. All right. Hi, David. So when you're creating a personalized exercise plan, where do you start? Like, what's your process?
Number one is always identify. So in today's day and age, there's so much information out there. Let's say shoulder pain. I can type in shoulder pain and I'm gonna get a million different hits. The hardest part is to know how to start for yourself so you get the unique experience of outcomes and progress based upon your unique issues. So for us to make it personalized, it comes from come into the clinic, have a conversation, figure out how you hurt your arm. What's your history? Why does it hurt? We call that root cause, right? What's the real cause of your shoulder pain? Nothing else can happen from outcomes, from results, from pain reduction until we as a clinician and you as a patient can identify the deficits that you have that's unique to you. So the personalization comes from first and foremost, identify the problem, where's the source, and then for us, we can create a plan that's tailored to your needs, but it really comes from the identification of the problem at hand.
All right, so once you have this insight, how do you tailor exercises to match someone's unique needs?
Perfect. So think that we talk about identification of the problem, right? So once the problem becomes known, then the solution becomes a lot easier. So I can't throw high-level stability exercises on someone that's rotator cuff deficient. So for us, we have the background in human pathology and physiology to know where we should start, how we should progress, and then how we should challenge our patients. So for us, once we identify the problem, let's say you have a shoulder issue and you're dealing with like rotator cuff impingement, right? We want to work on what we call controllable influences. So once we know that you might have some weakness in this area, or a ratio is off between front and the back, or you develop compensation, all we have to do is start at the fundamental, create things that are very simple. If it's tight, we can stretch it. If it's weak, we can strengthen it. So that's always our framework. So we identify the problem, right, with an evaluation. And then from there, it's just really creating solutions based upon the deficits that our patients have.
All right, so are there any exercises you find yourself recommending frequently because they just seem to work for everybody?
Yeah, good question, right? And so for us, we always want to start with wins, right? If we can reduce someone's pain experience right off the bat, day one, you're happy, right? We're happy too as a clinician. So typically, our starting point is creating a healthier environment. We talk about changing the environment to healing and active recovery. So let's say you're a shoulder patient, you have issues with pressing or pushing activities, right? We don't want to start out with those things that create aggravation. I always start out with what we call isometrics. So recreating a healthy environment for your tissue without causing or inducing pain. That creates a pathway to recovery where it doesn't hurt as much. And if it doesn't hurt as much, then we can start to load it. So our first starting base is an isometric. An isometric just means firing of the muscle without movement. So an isometric for my bicep, right? If I'm doing a bicep curl, right? An isometric of it is holding or maintaining that position without movement. So now I'm getting blood flow to that area, I'm isolating the issue, and I'm performing a task without pain. Right? So I typically say someone has a bicep irritation or tendonitis, I always start with isometrics. This can be with a dumbbell as well. For rotator cuff impingement, I typically start with isometric, where you can hold it yourself or you can go against a door frame and apply that same pressure. It's not a groundbreaking exercise. And the good thing is it doesn't have to be. If we can retrain your body to reduce your pain experience and allow you to build a healthy relationship to get you stronger where it doesn't hurt, that's where we start with most of our patients.
So how do you ensure the plans stay personalized considering everybody is unique?
Assessment and reassessment, right? I think the biggest thing we do to help our patients is high-level communication. One, we always have to know our intent. And for you as a patient, we want to know what you're working towards, what you're trying to do, what your goals are. We establish that day one. and we always are reassessing that. So assessment and reassessment is how we keep it unique. We're not just gonna come in and just do a couple exercises and then add a little bit of weight and do a couple of those same exercises. Each time you come in, we're always gonna reassess. We wanna make sure that the exercises you're doing at home, I view it as a chart, and our chart is on an easy, medium to hard scale. Is it medium? If things are too easy, you're not affecting change. If things are too hard, you're typically compensating. So we want to strike in that medium realm where we're able to make progression. So every time you come in here, to keep it unique, we always maintain communication. If things are too easy, I'm going to challenge you. If things are too hard, I'm going to show you how to regress.
So before we wrap up, any advice for someone watching who wants to kickstart their wellness journey or recovery?
Let's go back to how we know there is an issue or what we know the problem is. It's identification of the deficits. So one, if you have pain, don't just type into Google, my shoulder hurts, what can I do about it? I say the first thing we have to do is we have to think about it. We have to create a plan based upon deficits. The first thing is to identify the deficits and then build a plan from there. So a lot of times people will say, even when they come in here, I hope my arm gets better. I hope my shoulder gets better. Or I've taken time off and I thought it would get better and it didn't. Time and hope aren't a plan. That's just being passive. That's allowing something to happen. What we do is we take the active approach. We don't want to hope our way to get to pain resolution. We want to plan our way to pain resolution, right? So first and foremost, if you have pain, let's create a plan. And for us, let's create it together. That's our role, is to help you along that journey. So if you are experiencing pain, don't just do a couple exercises without knowing what you're doing and hoping it gets better. Identify the problem, build a plan based upon those deficits, and then progress every week.
Perfect. Thank you so much, David, for your time.